Hello, and welcome to today's webinar, Innovating the Negative Pressure Wound Therapy Standard of Care. This webinar is part of the Wound Source Wound Care Product Navigator series. The Wound Care Product Navigator series is an easy-to-access interactive learning lab for healthcare professionals to get the latest information they need on the wound care products available to them. Each webinar segment will take a deep dive into a specific product technology. This program will review a recent study comparing two negative pressure wound therapy systems. Our sponsor for this installment is Medela. My name is Janine McCauley from Wound Source, and before we get started with today's webinar, I just want to go over a few details. As a reminder, Kestrel Health Information does not give medical or reimbursement advice, nor do we provide medical or diagnostic services. The content of today's webinar is for informational purposes only. The views and opinions expressed in this webinar and content are solely those of the presenters and do not represent the views of Wound Source, Kestrel Health Information, its affiliates, or subsidiary companies. Now I want to take a moment and provide you with an overview of your webinar console. At the bottom of your console are application tools that you can use during the webinar. To submit a question to our guest speakers, please select the Q&A app icon on your screen and type your question in the field provided and select Submit. We will try to get to all of your questions during the question and answer period. You can expand your slide area by clicking on the Maximize icon on the top right of your slide area or by dragging the bottom right corner of the slide area. Our sponsor has included additional information on today's products. On the left of your console, you will find a list of resources available for download. This webinar is being recorded and will be made available on demand. If you have any other requests or questions pertaining to this program, please contact our sponsor using the Contact Us app located in the tray of your console. At this point, I want to welcome our featured speaker, Lilly. Lita is the Senior Director of Healthcare Sales at Medela and has over 30 years of healthcare experience. Lita, thank you so much for joining us today. The floor is all yours.
Emmy, thank you for that introduction. Today we will be discussing a paper that was presented at SAWC Fall 2020. The objectives are to review the mode of action of negative pressure wound therapy, to discuss the fundamental requirements of negative pressure wound therapy systems and their ability to deliver the clinical benefits, and to compare the ability of System A, the NVIA Liberty negative pressure wound therapy system from Medela, and System B, the VAC Ulta therapy system from 3M KCI, and their ability to deliver the set levels of negative pressure wound therapy and manage fluid volumes. Negative pressure wound therapy has become a cornerstone treatment for complex and hard-to-heal wounds. Its distinct mechanisms of action have been extensively researched and include the 6 listed here. Negative pressure promotes wound bed perfusion, draws wound edges together, promotes granulation tissue, removes exudate and edema, removes potentially infectious material while creating a moist wound environment. While there has been much discussion about the mechanisms of action, there's been little discussion around the fundamental requirements necessary in negative pressure wound therapy systems to deliver effectively on these mechanisms, as not all devices are the same. Therefore, in order to maximize the therapy's clinical benefits, a system must be able to consistently deliver the negative pressure wound therapy fundamentals you will see here. We have defined as Fundamental A, Fundamental B, and Fundamental C. Fundamental A ensures the delivery of the mechanisms of action 1, 2, and 3. Wound perfusion. To get the right amount of hypoperfusion in the immediate surrounding wound tissue and deliver an improvement in vascular endothelial growth factors, angiogenesis, local vasodilation, capillary permeability, and collagen deposition. If not delivered, it may affect cellular disruption at the wound bed and increase or decrease the desired granulation tissue formation. Fundamental B ensures the delivery of the mode of actions 4 and 5. If not delivered, it affects the ability to remove exudate, edema, or potentially infectious materials. And fundamental C, a sealed wound environment must be maintained to deliver negative pressure wound therapy. Only systems which are able to deliver on all three fundamentals are able to deliver upon all 6 modes of action. Throughout this presentation, we will take a closer look at each of these fundamentals and the role they play in promoting effective delivery of negative pressure wound therapy. We previously discussed the importance of fundamental A. The set level of negative pressure must be accurately delivered to the wound bed, and its influence on the first 3 mechanisms of action, the promotion of wound bed perfusion, macrodeformation through the drawing of the wound edges together, and microdeformation for the promotion of granulation tissue formation. In the upcoming slides, you will hear the results of an experiment conducted by a third-party independent laboratory. It was designed to compare the ability of 2 systems, System A, the Medela Invia Liberty, and System B, the KCI 3M VAC-Ulta, and their ability to deliver on both fundamental A and fundamental B. However, before we go into the experiment and the results, let's revisit the European Wound Management Association's consensus paper, which reviewed negative pressure wound therapy devices, and it provided insight and guidance into the requirement for a successful negative pressure wound therapy delivery system. In the consensus review, UMA discussed different types of negative pressure wound therapy systems. They identified that some battery-powered negative pressure wound therapy units use an electronically controlled feedback system to ensure the maintenance of the selected pressure level, even in the presence of small air leak, guaranteeing the effectiveness of negative pressure wound therapy and giving patients higher safety. Note that not all mechanical systems implement this feature. It is critical in the delivery of the set negative pressure at the wound bed when the wound and the device are at different heights. In the left image, where the wound and the device are at the same height, in the middle image, where the wound is above the device, and in the right image, where the wound is below the device. The ability to deliver negative pressure wound therapy can greatly vary. Without an electronically controlled feedback system, the set negative pressure at the wound can vary by upwards of 20%, particularly in the middle and the right images. The experiment consisted of 2 test methods designed to compare System A and System B's ability to deliver on both Fundamental A and Fundamental B. Test Method 1 tested Fundamental A. A pressure sensor was placed in the simulated wound bed, and a small amount of simulated wound fluid was consistently infused throughout a 60-minute test duration. Both systems were tested at 2 different pressure settings, negative 125 millimeters of mercury and negative 75 millimeters of mercury. Each system was tested 3 times, each at different heights, with the pump and the wound at the same height, the pump 1 meter above the wound, and the pump 1 meter below the wound. The objective of the test was to assess whether the systems effectively and consistently delivered the set level of negative pressure to the wound. This setup was used to test the same requirements in the UMA consensus guidelines for an electronically controlled feedback system. This slide shows the results after the test ran for 60 minutes. Through the use of an electronically controlled feedback system, both System A and System B reliably delivered the set level of negative pressure to the wound at both pressure settings and regardless of the height differential between the wound and the pump. System A and System B thereby meet the standard of care stated in the UMA consensus review on negative pressure wound therapy. System A, the Invia Liberty negative pressure wound system meets the standard of care through its double lumen tubing using a technology we call intelligent pressure control. The second fundamental B, states that a pressure gradient between the wound bed and the canister must be created for efficient fluid removal. This impacts the ability to deliver on mechanisms of action 4 and 5. In the second portion of the experiment, System A and System B were assessed for their ability to effectively deliver on Fundamental B, the removal of excess fluid, edema, or potentially infectious material. Before we discuss test method 2, let's review the foundations essential to the delivery of negative pressure wound therapy. The device must ensure that a pressure gradient is pressed to improve the removal of fluid. Electronically controlled feedback systems ensure that the set level of negative pressure is being delivered at the wound bed. It also introduces a differential every time the device opens the check valve, most commonly referred to as an airflow cycle or purge. Airflow cycles or purges check for blockages and create the necessary pressure gradient to remove fluid. Matter moves from high pressure to low pressure. In the model you see here, the blue dots represent high pressure and the orange dots represent low pressure. There are two different types of airflow cycles or purges. Static purges, which check at preset levels, in many cases once every 5 minutes. Dynamic airflow cycles, which sense changes in fluid volume or viscosity to prevent stagnation of tubing blockages. The FDA recognizes the importance of a pressure gradient as a key element of the therapy delivery, as highlighted in the definition shown here. Test method 2 tested the fundamental B, the removal of fluid. The test compares System A and System B's ability to efficiently remove fluid at pressure settings of -125 or 125-minute duration of the test. As in test method number 1, the data was recorded 3 times per system. And again, a sensor was placed in the simulated wound bed. Negative pressure was delivered for 10 minutes, and then a bolus of 150 mL of simulated fluid was introduced. The goal of this test was to measure the deviation from the set pressure delivered at the wound bed and the amount of fluid which actually was removed from the wound and delivered into the canister. System A evacuated 89% of the fluid in less than 20 minutes after fluid introduction. System B made minimal progress towards removing any of the fluid at all during the same amount of time. In fact, System B never reached 89% fluid removal throughout the 125-minute experiment duration. In conclusion, the Medela NPWT system exceeds the negative pressure wound therapy standard of care. You may ask how? Through a technology we call dynamic exudate removal. The double lumen tubing, the removal lumen ensures a pressure gradient to effectively and efficiently transport fluid from the wound to the canister. Not only more efficient removal of fluid, but also its ability to reestablish the set pressure at the wound bed as seen on the next slide. System A, depicted by the orange line, removed 89% of the wound fluid in the first 20 minutes to reestablish a patent system and returned the wound to the set pressure more quickly. System B, depicted in the blue line, was unable to effectively remove the simulated wound exudate quickly, thus impacting its ability to maintain the set pressure of negative 125 millimeters of mercury at the wound bed. In addition, its inability to remove the wound fluid quickly challenged the system to reestablish the set pressure at the wound bed. You can observe excursions well beyond the specified range of plus or minus 10 millimeters from the set pressure. It's important to note that the parameters that were used in this experiment were a replication of the data presented at the 2020 Symposia on Advanced Wound Care Spring, presented by System B's manufacturer. In conclusion, a patent system with a clear and unobstructed tubing between the wound bed and the device ensures the continuous delivery of set pressure. Dynamic exudate removal technology removed fluid quicker to reestablish the set pressure at the wound, exceeding the negative pressure wound therapy standard of care. Dynamic exudate removal technology removed fluid quicker to reestablish set pressure at the wound, thus exceeding the negative pressure wound therapy standard of care.
Fundamental C, a sealed wound environment must be maintained. Fundamental C, a sealed wound environment must be maintained. Without the sealed environment and with the presence of a small constant air leak, devices compromise the ability to maintain moist wound healing. Devices lose the ability to accurately and consistently deliver the prescribed pressure at the wound. Additionally, a constant air leak in a negative pressure wound therapy system also compromises on fundamental A, the ability to deliver and maintain the set pressure at the wound.
We know that negative pressure wound therapy has become a cornerstone treatment of complex and hard-to-heal wounds. Yet despite much discussion about the mechanisms of action, there has been relatively little discussion around the necessary requirements of a negative pressure wound therapy system which facilitates these mechanisms. It is our view that the goal of negative pressure wound therapy is to ensure consistent delivery of the three fundamentals that we outlined today: the ability to maintain and control the pressure at the wound bed, the ability to effectively remove fluid, and the ability to maintain a moist wound environment. The Medela Invia delivers all three of these fundamentals through intelligent pressure control and dynamic exudate removal technology. It removes fluid more efficiently and delivers more consistent pressure, thereby innovating on the standard of care.
Healthcare is changing. Has your negative pressure wound therapy evolved?
Lita, thank you so much for the presentation. We are now going to begin our Q&A session, and joining us for this Q&A session is Peg Minacci, who is the Clinical Sales Specialist for Medela. If you have a question for Lita or Peg related to today's program or Medela, please submit your question using the Q&A app found on your console. We'll try to get through as many questions as we can in the next few minutes. Now, for our first question, is there evidence to show faster wound healing with dynamic exudate removal?
Well, the ability to remove the fluid more quickly and thereby return the wound to the set pressure more quickly through a patent system helps to deliver on the mechanisms of action to quickly and consistently deliver negative pressure wound therapy. Peg, what's your experience?
Well, let's look at chronic wound fluid, because that's what we're talking about, with these chronic wounds. We know that in chronic wound fluid, there are inflammatory mediators and destructive MMPs that inhibit the healing process of the wound. So it just makes sense anecdotally if we continually monitor that wound and we're continuously dynamically removing that chronic wound fluid, we're giving that wound a higher chance to heal. So let's look at non-chronic wounds. You have a patient with lymphedema or on skin grafts, where it's absolutely critical to remove that fluid, you want a dynamic exudate removal to be able to do that more efficiently. That make sense?
Yes, absolutely. Thank you both for that response. Now, what does removing fluid more quickly have to do with clearing obstructions, or in your word, maintaining patency?
Well, that's a great question. First, let's define patency. So patency is the removal of an obstruction in order to clear a line. From a negative pressure wound therapy perspective, this means maintaining a clear tube or system between the wound and the device. The quicker the fluid is removed, the faster you will be able to return to the prescribed pressure, as we showed in the presentation today. Allowing the pressure to stay elevated or extended for a period of time can be detrimental. Returning patency in the tubing involves releasing the pressure gradient, and when this is done through the use of the check valve, also known as an electronically controlled feedback system, then you have a patent system, and it's important to ensure that you can consistently deliver the set pressure at the wound bed itself. Anytime you have fluid in the tubing, you're going to have some level of change, either plus or minus, to the desired set pressure at the wound. So the faster you can clear a tube and have it be fully patent within the system, the faster you're going to get back to the desired set level of negative pressure wound therapy.
Great, thank you. Now, before our next question, I'd like to invite our audience to take a moment to please complete our quick poll, which should display on your screen here momentarily, to help us find out how many have joined us for today's session. The question is, how many people, in addition to yourself, are watching the webinar with you today? If you are attending this webinar by yourself, simply enter a 0. If you are in an in-service setting, an estimate is fine, and we thank you for your response. Now, while our audience is answering that question, for our speakers, what is your take on putting negative pressure wound therapy on circumferential defects on limbs, especially in the elderly population?
So that's a great question with these types of wounds. I'm going to pass this over to our clinician, Peg, to give her perspective from a clinical perspective where negative pressure is used in these challenging wounds.
Thanks, Lita. Yeah, that's a great question. We see negative pressure used a lot in these vascular wounds that take up the whole cast in our elderly population. It's important to remember that we do not want to put the film from the negative pressure horizontally around the wound because that creates a tourniquet effect. What we like to see is putting the film in strips vertically up and down the leg, so we're not creating a tourniquet effect and we're giving it a little bit of room to move. So I hope that answers your question.
That was great, thank you. Here's another one. This audience member says, I have seen more and more of the disposable negative pressure wound therapy in use. How does the information you presented apply to these units?
I'm going to pass that over to Peg. That's a great question, and she sees this all the time.
Yeah, we see a lot of these disposable units being used out there. Let's go back to the fundamentals. Our small unit is the motion. It has a canister, and it is able to measure at the wound site. So again, that is the requirements from the European Wound Management Association. The disposable units do not have that ability. So, you know, they cannot measure at the wound site. So I have seen them being used inappropriately with wounds that are highly exudating, and they just cannot manage the exudate. So that's the difference. Ours is not a disposable unit. It's a fully functioning negative pressure according to the standards that have been set. Lita, anything else to add on that?
Yes, Peg. I would add also that devices without a canister, known as disposal negative pressure wound therapy devices, cannot measure the pressure at the wound site as you indicated because of the lack of the pressure gradient as we discussed in this presentation. Both products by Medela have proprietary technology of intelligent pressure control and dynamic exudate removal.
Great. Thank you both so much for that explanation. Now, this audience member wants to know if you can review again why a pressure gradient matters.
Sure. And this is a great question and something to really try to think through about negative pressure wound therapy and understand why devices do what they do. It is vital to maintain patency or an unobstructed tube in the vacuum system. The material and the matter in the system will always move from an area of high relative pressure to an area of low relative pressure. The relative difference between both sides in the system creates the speed or the power with which you can remove the fluid more quickly. So having a gradient is critical in order to be able to effectively remove the fluid or material from the wound to the canister. And the better gradient that you have within the system, the more quickly the fluid will move. If you have the same pressure on both sides, let's say the fluid and the tubing, the fluid itself will actually remain completely stagnant and won't go anywhere. So again, it's critical to have high pressure to low pressure. And that's what you get from an electronically controlled feedback system within devices that have this type of a feature.
Great, thank you, Lita. Now here's an interesting one. This audience member says, I have seen data comparing negative pressure wound therapy devices showing they remove fluid over a 24-hour period. How does that compare to the data you provided?
This is in reference to the poster that was presented at SAWC Spring, which I discussed during the presentation. And that data was presented by manufacturer B. The data looked at a 24-hour period for the removal of the wound fluid, whereas this experiment looked at approximately 2-hour removal of fluid. The difference was the time that it takes for a device that has dynamic exudate removal to remove the fluid versus a device that has a static air cycle purge. So the comparison in this experiment was looking at the differences in the electronically controlled feedback system within the two devices, and thus the time.
Great, thank you. Now, why is the pump that dynamically adjusts better than one that does not when it comes to patient care?
Again, not all wounds are the same, and not all wound exudate is the same. And there's a lot of changes that occur within the wound healing process. And as Peg mentioned earlier, when you can maintain a moist wound environment, not too wet and not too dry, you get the ideal outcomes. And when you're able to have a negative pressure wound therapy system that senses an increase in volume or viscosity and responds, that's what you're looking for. That's why it's better to have a dynamically adjusting system that can manage to the changing needs of the wound.
Yes, and Lita, if I can add, let's look at a complicated patient and see how this relates to that. So we have a patient who's a status post hernia repair, who dehisced and had to be taken back to the OR. Now they have a large wound. They have fluid overload. They're laying on their back in the ICU. They have negative pressure on their big abdominal wound, and we have to turn them now. So we turn them over, and so all of a sudden you have this influx of fluid. With our product, right away you're going to detect that influx of fluid, and it will start the air cycles again to remove that fluid. So if you have a pump that doesn't do that, what's going to happen? First of all, you're going to have leakage in the dressing, and you're going to have alarms. So when you get down to the practicality of it, as nurses managing these wounds and these pumps, we want to have less alarms and less leakage. And that's what we see.
Great. Thank you both for that answer. We have time for one more question. Can you explain again what you mean by a closed system versus an open system? Why can't an open system measure pressure at the wound?
Sure. An open system is like an open window. You have a breeze continuously coming through. And as soon as you create a hole or a leak in the system, the negative pressure that you have set at the pump versus what you're delivering at the wound will likely vary. That's the difference. A closed system will ensure that you maintain a moist wound environment, and critical that you ensure that feedback loop with the double lumen system via the electronically controlled feedback system that will help you maintain the pressure at the wound bed consistently. And if you're not maintaining that negative pressure, you end up running the risk that you're not delivering the full fundamentals or all of the mechanisms of action of negative pressure wound therapy.
Great, thank you. Now that's all the time we have for today's program. I want to thank you all for your questions. If your question was not answered today, a Medela representative will reach out to follow up. This webinar has been recorded and will be made available in full on-demand after the program. Please look for our follow-up email that will alert you when the on-demand recording is available so that you can review any material you missed or simply go over the program again. Also, you'll be redirected momentarily to a form to indicate your interest in speaking with a sales representative for Medela. I would like to extend a warm thank you to Medela for sponsoring today's program. On behalf of today's presenters, Lita, Lilly, and Peg Menacci, as well as the teams at WoundSource and Medela, thank you for joining us and for taking the time to view this webinar. Have a wonderful day.